Sybil, Dr. Jen overslept, and she called and apologized. All right, it's Get Well Wednesday. Your new best friend, Dr. Frida Lewis Hall, is on the phone, Sybil. She's calling from Italy. Congratulations.
I sure am. Hi there.
Ciao, Bella.
Ciao, Bella.
Yeah. Okay, Afib. Let's talk about that again. Afib.
All right, let's talk about AFib. So I just want to remind everybody what we're talking about. It's called atrial fibrillation.
Yeah.
Some
AFib.
people like just to call it AFib because that's a lot easier.
Yeah.
Now, this is a common type of arrhythmia. Let me remind you what an arrhythmia is. It's a condition in which your heart beats too slowly, too fast, or in an irregular way. Now, this irregular heartbeat, which can sometimes feel like there's a flutter or palpitation in your chest, makes it hard for the heart to actually pump enough oxygen-rich blood to the rest of the body.
Mm-hmm.
And so that is not a good thing, Doc.
Oh, no, not a good thing at all.
And
So-
how common or uncommon is it?
Yep, so AFib is very common. Unfortunately, not a lot of people know about it. And remember, AFib is a condition that just isn't a threat to your heart. In this condition, blood may not completely pump out of the heart and may actually pool in there. This can cause blood clots to form. Now, the clots that form in your heart may then be pumped out of your heart and can actually travel to the brain. If a clot travels to the brain, it can block off the blood supply, and you know what that means. That can lead to a stroke.
There you go. And what is the greatest takeaway you want people to have from all of this, Doctor?
Yeah, so the headline of this is that patients with AFib have up to a 5 times greater chance for a stroke than those with regular heartbeats. 5 times greater chance for a stroke than those with a regular heartbeat. Also, AFib-related strokes are often more severe than non-AFib-related strokes. So if an AFib goes undetected or untreated, it can lead to life-threatening complications.
And can you talk about the connection between atrial fibrillation and strokes?
Absolutely. While AFib is a significant risk factor for stroke, it can many times go undetected, and many are not familiar with this condition at all. So there was a survey that was conducted recently, a national survey, that was done by the Harris Poll on behalf of Matter of Moments, which is an initiative by Bristol-Myers Squibb Pfizer Alliance. Now, in this survey, they talked to over 1,000 U.S. adults aged 40 and older. And what they found was that nearly 2/3, 61%, of these adults are not familiar with AFib.
And the numbers that are also kind of overwhelming in terms of AFib and the connection there, especially as far as our risk factors are concerned, are overwhelming as well.
Absolutely. So out of undiagnosed adults, so these are people who do not have or have not been diagnosed as having AFib, 40 and older, with one or more risk factors for AFib, 89% may not believe or aren't sure that they are at risk for AFib. And this is just incredible, nearly 90%.
And some of the other numbers, and as you might expect, there are some other numbers that are involved, and especially as they relate to our risk factors.
Yeah, so this is, I want to underscore what's so important about AFib. There may not be any symptoms, so it's important that you know your risk factors. And what are they? So the first is age. It's a major risk factor for developing AFib, especially if you're over 65. Other risk factors for AFib include, but they're not limited to, a history of high blood pressure, heart disease, obesity, and then chronic conditions like thyroid problems or diabetes, asthma, sleep apnea, or excessive drinking.
Who doesn't have that? All those things are risk factors that you can raise your hands to. More information? Where do we get it?
Yep. So for more information about AFib-related strokes and their relatedness to stroke risk, you first speak to your doctor, but also you can visit amatterofmoments.com or go to gethealthystayhealthy.com.
All right. Thank you. Thank you, Dr. Frida Lewis Hall. Thank
Chief
you, Pfizer.
Patient Officer at Pfizer. Thank you, ma'am.
Enjoy Italy. Roma.
And thank you.